All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening, dear friends. Hope all are doing well. Welcome to BMC Global Live Al Hilal Health World, nothing but lifestyle. This is a talk show exclusively with expert doctors of Al Hilal hospitals and medical centers. The doctor joining us today is Dr. Khalid Afifi from Al Hilal Hospital, Sitra. So, welcome doctor, welcome to the show.
Thank you for having me over again.
He is from the Department of Family Medicine. And the topic we would be discussing today is about chronic pain. So doctor, what is pain and how do you define pain and how does it present itself?
So pain is, I guess you could relate it to the sense of touch in one sense. It's one of the things that we can feel, it's one of the senses. I guess it's on a spectrum, If you put it on a spectrum, touch can be painful. If you pinch someone, that's pain. That's also touch. That's pressure. One of the things that we feel. Now, how it works and the science behind it is that there is a connection. The mind keeps a connection, or the brain keeps a connection to every point in the body at all times to help its function. One of those things is pain endings, and a sensation specifically made for the sensation of pain, different types, that goes back to the brain, and it tells us there's something up there. So in a way, it's your body's way, one of the ways that a body talks to you, actually, about things. It's a very important and innate function of our human being living, because it tells us, it teaches us, it maintains self-preservation, and how it ends up being felt also is in a big wide spectrum. So pain can relate to temperature, something can burn hot, and pain can be visceral, internal organs, and the one that we might hear or see most complaints of is physical pains. Let's call them mechanical. Bones, joints, muscles. You can have these kinds of pains. Of course, not even mentioning mental and emotional pains. Why not count them in as well? Okay. So chronic pains is, as you mentioned, dealing with these, any of these, for a long time.
That's a chronic pain.
That's a chronic.
So, doctor, the two terms, disease and illness, we often mistake one for the other. Mm-hmm. So, what is your point of view of disease and illness?
Okay, so medically speaking, a disease is the name, the entity. What's the diagnosis? What is the disease? And illness is a little bit more broad, where it's how a given disease affects a specific person. Whereas, for example, two people could suffer from the same disease, but it affects them differently. And that effect of them is the illness. So two people have the same disease of a flu, but the illness of each of them is different. Okay. In a much similar sense, pain, perception of pain can be counted in the same variance. Two people can be feeling the same pains, but it will affect each of them different. We call it pain threshold, pain tolerance. Okay. How much can you handle of pain before it becomes severe, excessive discomfort, So some pains even be as little as a discomfort more. It's not an actual pain, just a discomfort that's there. That's the level.
Illness is how the disease presents itself. Is it so?
Yes. It's exactly that to that person, and only they can tell you that. Mm-hmm. Only they. That's the interesting. But only they can tell you that. So that's why much when you're dealing with pains, you have to listen. The person has to listen to their own body, and the doctor has to listen to the patient also, especially if it becomes a chronic pain.
Okay. Now, doctor, what are the different types of pain, and what are the variations?
So, if you divide pain, medically speaking, we can divide it differently than how the patient would. I'd rather to look at it from the patient's point of view for the sake of this, because we're trying to get a message out about this to people. Is that we would look at it by which nerve fiber is carrying that type of pain.
As a doctor.
As a doctor. But not relevant to how it's actually being felt as a perception. So most people feel the pains like we divided them earlier. Visceral, which is body organs. Think of body organs, usually in this area. And the headache, it's a brain's pain. That's a brain's pain. Headache. That's you can have it in this box here, lungs, heart. So these are the different pains, and the variations of them, we get many descriptions. Most people come to the clinics and they have many descriptions for their pains. Some might call it sharp. Some might call it gnawing. Some might call it colicky, which is a squeezy pain. That's usually guts and flanks, kidney stones. For those of you who felt them, I'm sorry. It's not fun. And they're very difficult to see even sometimes, the pains. So you can also have hot pains, warm pains, or it just feels hot. Sometimes even one that I often get is someone who has a chesty cough. They won't describe it as painful, they describe it as hot or warm. And it's a repetitive one, it's not like one or two people. It gets like a hot cough. So there's many different variations to pains. That's the viscerals. Then you also have the sharp pains. They can be also in the body, or numb pains, bruise pains. So when you talk about pains, it's many different descriptions, and all of them can tell us something. Each type can tell us something.
Doctor, can you describe the chronicity of pain, and how is the duration? How long will it last?
It's a bit of a more difficult one because, okay, so we call it acute, subacute, and chronic. Acute is averagely 2 to 4 weeks.
2 to 4 weeks, okay.
1 to 3 months of acute, going on to chronic. Now, we also look at the severity of that pain. Something severe and acute, you have to, of course, it's a red exclamation mark, a red flag. Yeah. We also look for other things around it in the history taking, in the other physical examinations always. But something that's severe always has to be addressed. It's a point of index. Acute pains up to 1 month, and further than that, chronic, and they each require different managements and different type of being from the patient to manage them also. So that also becomes a difference. Acute pains, we'll think of them as, say, for example, as we mentioned, usually visceral also happens a lot. Stomach bug, we hear that. I got a stomach flu, I got the stomach bug, that's queasy pains. Someone's not feeling well, that's the type. People also can be feeling them very differently. Sometimes you get people, yeah, I've got them. Are they bad? Yeah, they're really bad, but they're sitting there. Sometimes they will come and they will be feeling them so much that they can't sit still. So this is also a difference. That's perception. We have to pay attention to that in the severity index. We cannot tell someone, no, you're not feeling that really that bad. It's not. So then we go to the chronic pains. Now the chronic pains can more likely present as the physical ones. Those can be chronic pains of bones, joints, muscles, and also the visceral ones for people who have some irritable bowel syndromes. They might have a lot of these colics happening intermittently, flare up, flare down. They can have one that can be common, especially in the rise of high cholesterol levels, is fatty liver disease. For many people who come through, it's a very uncomfortable condition. And when they describe how their body feels, sometimes, especially after a heavy meal, it sounds painful. It doesn't sound nice. So even, for example, then you talk about heartburn pains. You're talking about stomach pains, side pains. It can just feel like a heaviness there. That's a dull pain. Call that dull. It's not really sharp. It's the opposite of it. But mainly chronic pains end up being either a chronic condition or body pains. And there's always something that can be done about either one. It's a matter of getting to the diagnosis. What is the disease? Can be a confluence of things, can be a natural progression of life even. People get older, they can feel more pains. How do we manage these things? And for chronic pains of the body, honestly, this is where movement is medicine. And as the other saying goes, is motion is lotion. Yeah. So you have to keep going. You have to keep going about it. Even though it's painful, it's not about, okay, don't move, because that's one of the worst things that you can do unless you should be immobilized. But it's more about do the right movements and know how to do them. And that's where really big time physiotherapy and rehabilitation come. And those are two intricate things. And I'm glad that as part of the family medicine practice, especially in Hilal Sitra, I have the physiotherapist 2 doors down from me. Okay. So quite often there can be very immediate and close communication between the patient's needs, and things can be tailor-fit, because most chronic pains, if they are not of a specific disease, actually most pains that someone can feel are due to weaknesses. So weakness has its own kind of pain that it comes off with, and it can be imbalances. It can be this muscle is overcompensating and it just throws the whole mechanics off of the bones, joints, and that's body pains. Most people who come through with low back pains that are chronic benefit, and research shows that over and over and over and over again, that benefit from physiotherapy at whatever level they have. So even the person who did a back surgery, who has a lot of pains, we put them in a swimming pool and they do the physiotherapy. That's hydrotherapy, water therapy. It takes away much of the weight and much of the gravity, and it allows them to reach, range of motion, things that they could not do outside of water, but at least their body is recognizing it can do it. It helps. You're rebuilding connections, and it makes you stronger. So strength overcomes the weakness pains. That's the one main thing. And that physiotherapy helps with. It's the three things, mobility, flexibility, and then strength. And they're endless. Each one that you finish with, you go to the next. There's always a next level. Meaning that there's always something more that you can do regarding to a big portion of physical pains.
For this chronic pain, then the other visceral pain and other body pains?
So we'll go into it like into usual partitions. There's the natural way, what you can do with the lifestyle way, and then there's the pharmaceutical way. Even the pharmaceutical can be either chemical or nature-based or whichever, but on average, there's always something to do on the lifestyle side. So one of the ones that we mentioned, the exercise for physical pains, that's a lifestyle decision. You're getting up, you're exercising, you're doing the work, you're sweating, all this. Now, for a visceral pain, for example, fatty liver disease, as we mentioned it earlier, you must abide by a certain diet and work on it with burning it off, and in 6 to 12 months, see what happens. The indicators, do they come back to normal that we look for? That's why we order tests. We're trying to keep track of certain things, getting a pattern. Is this working or is this not working? It's not all haphazard. So when we look into that, we can see the symptoms. Then the clinical, the patient might come back and they might say, I'm not getting the gastric problems anymore. I'm not getting the heartburn. I don't have this aching pressure pain here after I eat a meal. Like I'm working overtime to digest it. And they will also be much more educated about their pain, surprisingly. And most people who end up doing this, when they go and they do what's right and they come back, they might have a story of that one time that they made the mistake, and they're like, now I see it. Now I see what I was doing for years, every day normally before. Now I see how the difference is. That's a precious moment. They overcame pain. So to overcome pain, now some things you can't treat the cause, you can only manage chronic pains. This is a fact also. So you have the cheerful, but then you have sometimes that you're sad to say to the person, you're going to have to learn how to deal with it, live with it. And this becomes a very intimate conversation between that person, their body, how they feel, how they manage. Patient education is key. If you tell me what is there to do about chronic pain, patient education is key, actually, in this matter. With their cooperation, things can happen with patients. And then you have the point is of any needed medication can also be prescribed. And thankfully, there's plenty to do in such cases now. Things are always coming up, improvements, research, we're learning things. So always go see the doctor if you have any chronic pain and ask about what can you do overall for either one. Sometimes there's subspecialties that can deal with it very detailed, but on average, most chronic pains can be managed or helped by a family physician. You can give a lot to up until a fairly certain level of depth, and then you have to go for more. Except for averagely neurologic pain, we tend to refer. Neurologic pain usually is very medication based alongside with what can be done, but it's a very deep-seated pain. So one of the main things that also works with it is physiotherapy to the most part.
Okay. So while dealing with these pains, do we have to consistently work on them?
Well, consistency is the key. Consistency is the key.
As you mentioned earlier,
Yeah.
We have to be consistent in
Yes.
our lifestyle modifications
Consistency
also.
is the key, yes. Because not just as I mentioned, as people keep mentioning also to me, as we notice the trend, as patients sometimes come back and tell me, they notice. And for everything, it is the key in way of life in general. But let's take, for example, the weakness pains that we were talking about earlier. So that happened. It was done away with, but it was there in the first place for a reason. Because what you were doing was not being done. And as soon as you did it, it went away. Because it was replaced by strength. Now, if you stop, you might have bought yourself some time, 1 month, 2 months, but are you going to keep it up for 10 years? Yeah? So who's going to win at the end? Unless you do something, weakness will win. Use it or lose it is the way of the human body, and use it in the right, correct, good way. Now that becomes a very different level, perception. Sometimes someone can only be capable physically of 40%. Do that 40%. Because use it or lose it. In 10 years, God forbid, it might become 30. So it's a use it or lose it type in these situations, and if you can't use it 100, use it whatever you can, but do it.
So consistency is the key.
100%.
So doctor, can we prevent this type of chronic pain?
Yes, it's depends on the diagnosis always, depends on the reason, but can you prevent many and most to the safe degree? Yes, especially the physical ones. And then you can have healthy living where pain is not a baseline thing, where it's not like, oh, my pain today is 3, 4, for one reason or another. One reason or another. Once, especially when you're thinking, for example, an acute injury that you will get over and you're prognosed to get over well. Prognosis is how we imagine the course of the treatment will go on, the management, time frame, and so on. But only God can tell how when someone gets the point of healing that they count as healed. But the estimations, yeah, it blends. For example, someone had an ankle injury. Now they have to do from the start, even learning how to step on them. Painful, there is limitation. Now, you go on to strengthen it, and then this person now can go back to playing football. Now, at what point he will be aware of this? It might always have this, oh, if you do me wrong, I will do you wrong. That ankle will just be looking up at him like, don't play stupid games with me. Sometimes it's like that. So what they do is that they progress. They keep doing specifically for it to strengthen it because they know it might be a weak point. And they will feel it more. They will have that more communication with it. Sometimes you end up respecting a part of your body more if it has hurt you. You watch out for it. You treat it more carefully. Yes? Normal. So you strengthen it. And that becomes what? That has gone into the realm of prevention. Now, a lot of athletes, what they do nowadays is something called prehab, not rehabilitation. We add the prehab. So you it's preventative rehabilitation. They are doing all the movements that they might count functional or related to their sports or their life.
This chronic pain.
Yeah. So physiotherapy, it encompasses a lot of things. So you have modalities, what we call the modalities is any machine. Then you have manual modalities, be it with the aids of tools. And then you have the actual bulk or needed part that you want to get back to, which is the movement part. That is the 3 triangles. And you usually start them all together and then stepwise. Mobility, flexibility, and you have strength. Now, mobility and flexibility usually get interchanged, the same as disease and illness gets interchanged. Yeah, this is also interchanged, but it's a little bit different. Mobility is range of motion with control. Flexibility is how far can you reach if someone took and, can you do the splits or not? Mobility is being able to really properly control it in strength, and then strength comes into play, and that makes the control. If you're able to do all these things, you're preventing that at any given point, when you're reaching that extreme for any reason, that you will not have control, and that's when most injuries happen, when there is not control on the movement. When you lose control on the movement, that's when you're most prone to injury. Long loading of weight. That's in the bones or orthopedics. That's usually most, especially if it's for athletes. You see footballers are running straight, suddenly they stop and they turn. Yeah, they're doing it very fast, and that's sheer force all over the ligaments. Most average people could not do that unless they do the work, progress, prehab, train slowly over years. Then they gain that as a skill. That's a skill right there. That's why they get paid, I guess.
So, doctor, before we wind up, what do you have to say about Al Hilal Healthcare?
It's been a pleasure working with them, honestly. What I can tell from Al Hilal Sitra, what we have is a very cooperative team, and we're all interlinked, and we discuss and we talk and we refer, and it's nice. It's a cozy setting, and it's nice, as I mentioned earlier, that I have the physiotherapist there, 2 doors to my left. About 30 meters away, I have the orthopedics and ENT doctors. So if there's anything, they're even a step away. We have a multidisciplinary team, and that aids a lot, that we can do a lot in-house. And that's the way that Al Hilal is generally set up. And no wonder that they're the fastest growing chain now, 9 branches. The most recent in Manama Central, props to that. So I like working for Al Hilal because of what we can do for the people, and especially as a family physician in dealing with all this, it's a very good place to be.
And finally, do you have any advice for our viewers?
I would say to everyone who is having chronic pain that you can't know how much you can do to get over it or in the journey of improving from it. Nobody can always promise you 100%, but you will never know 80% or 90% if you stop at 60. So talk to people who can help you. Talk with yourself about it, see what you can do, and then do it. Chronic pain is something that you may live with for a long time, so do something about it. There's always something to be done.
Thank you, doctor. Thank you for joining us and giving us a lot of valuable information about this chronic pain.
It's a pleasure.
Thank you once again.
Thank you.
So viewers, as doctor said, if you have any chronic pain, go for medical intervention on time and lead a normal life. Till we meet again next time, this is Jasseela Mujeeb signing off. Good night.